Honorable President of the 54th Directing Council, Your Excellency Don Juan Orlando Hernandez, President of Honduras and the First Lady of Honduras, Secretary of Health and Human Services, Ms. Sylvia Borrell, Government of the United States of America, Honorable Ministers and Secretaries of Health, Secretary General of the OAS, Senor Luis Almagro, Honorable Assistant Director General of the World Health Organization, representing Dr. Chan, Director General, distinguished delegates, ambassadors, distinguished members of the diplomatic corps, esteemed colleagues and guests. A very good morning to all of you. Today it is my very distinct pleasure to welcome you to this, the 54th annual meeting of the PAHO Directing Council. You have journeyed from every corner of our region and in some instances beyond to be here, and I sincerely thank all of you for securing this time on what is very busy agendas and schedules to engage in what will surely be a rich and productive discourse about health in our region. This morning, I am particularly delighted to welcome you all to this PAHO House. Yesterday marked 50 years since this building was first opened in 1965, and the 50th consecutive occasion on which the PAHO Directing Council has been convened in this specific building at 525 23rd Street, Northwest Washington, D.C. So happy anniversary to us all. On a more solemn note, I would like us to remember the many persons in our member states who have suffered loss of life, property, income, and health due to disasters and disease outbreaks over the past 12 months. We specifically remember the residents of Chile and those in my own homeland of Dominica who more recently have had to endure the assaults of nature. Given the fact that we live in a global village, we must also remember those in the other WHO regions who lost their lives in the extensive Ebola outbreak, as well as in the Nepal earthquake and wars and conflicts. While PAHO is the oldest international technical public health agency in the world, having been founded in 1902, our uninterrupted growth and successful functioning have been due in no small measure to the valued and insightful guidance that the Secretariat has received from the member states for more than a century. However, now more than ever, in this complex, ever-evolving global health arena, we continue to seek your input, your fresh ideas, and your wisdom as we navigate new waters to achieve the goals of the post-2015 Sustainable Development Agenda, as well as those of our Strategic Plan 2014-2019. As we have journeyed over these many decades, under your watchful guidance, I believe that we have collectively achieved much, ranging in the early years from intense capacity building of national human resources to the eradication of smallpox, the elimination of polio, and most recently, rubella and congenital syphilis, to the application of low-cost technologies for the prevention and control of cervical cancer in underserved population, to a 2014 commitment to universal access to health and universal health coverage, building further and more explicitly on the 1978 Alma Ata goal of health for all. Our cumulative achievements have been realized despite the numerous challenges that we have encountered along the way and in the face of the new and emerging challenges that we face daily as the world evolves. I am ever more convinced and excited that together we are creating dynamic reforms that extend from the corridors of governments to the cities, to the towns, the villages, and to the very homes of the population we serve. These reforms do truly transform and enhance the quality of people's lives in our region. Whenever I visit member states, in addition to my advocacy engagements with presidents, prime ministers, ministers of foreign affairs, and others, I embrace every opportunity to observe programs in action and to understand from those involved what works well, what is still of concern, and what lessons we have learned. I am greatly encouraged by the innovation and progress that I have observed during 17 visits to countries in the last year. In Ecuador, for example, I noted with great interest that the government, as part of a continuing process, was actively establishing measures to improve quality in health and in their health system. And in this regard, it created the Agencia de Aseguramiento de la Calidad de los Servicios de la Salud, ACCESS, that will work to assure the quality of prepaid health and medical services in that country. Developments such as this will potentially lead to enhanced quality in Ecuador's health services and systems. In Chile, I have observed significant progress regarding the labeling of foods that are high in calories, sugar, salt, and fat as new regulations were approved by the government. This innovative development will assist Chileans in making better decisions regarding nutritious food choices and in the long term, reduce the potential development of chronic non-communicable disease risk factors. Similar progressive initiatives related to food labeling have also been noted in Ecuador, Mexico, and the United States of America. In the Commonwealth of the Bahamas, an archipelago of some 700 islands and keys spread over 100,000 square miles of ocean, the government has committed itself to the introduction of a national health insurance initiative in order to extend universal health coverage and access to health for all of its inhabitants. They have been working assiduously with different sectors and stakeholders to determine the optimal benefit packages and structures in the face of challenges from some whose primary goal is the protection of their own financial interests. Panama has also embarked on a program of ambitious health reform. On another front, Nicaragua and Uruguay became the first two countries in the world to ratify the World Health Organization's protocol to eliminate the illicit trade in tobacco products. I applaud these member states for taking this fearless step towards reducing tobacco consumption and for setting a sterling example that others can follow. Every day, I see the ingenuity, the courage, and the fortitude of member states as they valiantly attempt to improve the health of their peoples, even when they must struggle against obstacles erected by those whose fundamental interests may be at variance with the protection of the public's health. In some instances, ministers of health have been forced to struggle even with their national medical associations and councils. Clearly, the Americas region is a trailblazer, largely thanks to your collective leadership and your tireless work in improving the social conditions and the health systems within your countries. However, I do recognize that in some areas, we feel some frustration as the required transformations and positive long-term benefits and impacts are not occurring as speedily as we would like them to. Reducing maternal mortality in the region, MDG Goal 5, is one example of a goal that has been plagued by insufficient progress. While maternal mortality has declined some nearly 40% in Latin America and the Caribbean between 1990 and 2013, this was far below the 75% reduction target that was set out in the Millennium Development Goals. According to the most recent data in 2013, some 9,000 women in our region died from maternal causes such as obstetric hemorrhage. Clearly, this is unacceptable for all of us. It continues to be an indictment on the access to health services and the quality of care in our region. Another area requiring additional member state dialogue and closure relates to our engagement with non-state actors. Communication with this sector is essential in order to foster an improved understanding of critical health issues and to ensure access to the best quality and the most affordable public health interventions for the region. Sadly, just last week, the press here in the United States of America reported that the price of an older drug, daraprim, which was used to treat malaria as well as toxoplasmosis, has jettisoned from around $13.50 to $750 overnight. Looking ahead, therefore, we must simultaneously protect the gains that we have already realized, address our unfinished agenda items, and build a bridge to address the broader and even more ambitious Sustainable Development Goals. Adequate funding is, of course, critical for our success, along with effective coordination among and between the various sectors and stakeholders in order to make the best possible use of all of our resources. This week at the United Nations, 193 countries adopted the 2030 Sustainable Development Agenda, which aims to eradicate poverty, fight inequity and inequality, and tackle climate change over the next 15 years. This agenda, which consists of 17 goals and 169 targets, seek to boldly address the indignity of poverty and inequity that plague human development and proposes development that is people-centered, holistic, comprehensive, and integrated. I am happy to report that our PAHO Strategic Plan 2014-2019 is fully aligned with those objectives and approaches of the Sustainable Development Goals. Last week, we also had the visit here of the Pontiff, Pope Francis, who hails from our region, and we are particularly proud of that. He repeatedly reminded us of the all-important need to ensure that the poor, the disadvantaged, and the vulnerable are afforded the opportunities to develop and to live with the highest dignity, and that we work to preserve nature and life. He considered this our moral obligation. It is my hope and plea that these sentiments and global commitments will provide a fitting context for our deliberation over the next week. These joint deliberations will help us better define our agenda, sharpen our focus, and set the tone for the coming months. I do look forward to these discussions with great enthusiasm. We have a full and interesting agenda before us. We will address a wide variety of topics, public health, as well as critical programmatic and policy issues, in addition to being updated on technical, administrative, and financial matters. Finally, in conclusion, from my personal perspective, it is immensely gratifying to be a part of this distinguished assembly, defined and unified by our wholehearted dedication to the health and well-being of those who live in the Americas. Inspired by your dedication and leadership, I am as confident as ever that we will have a successful journey together. Thank you very much and welcome.